Hello and welcome. I'm Matt Shamblin, RN, CEN, TCRN. Many of you may know me from Welch Community Hospital's ER. And today, I'm here to talk to you about steps that we can take to live healthier lives. Whether you're managing a chronic condition or looking to prevent health problems in the future, there is something here for everyone. Let's take this journey together and build a healthier community one step at a time. So let's take a look at what we'll cover today in this presentation. You will learn why prevention is important for our health and our families, how to eat healthy on a budget without sacrificing taste, creative ways to stay active even when you are busy, stress management tips and mental health resources, and the power of small changes to create a lasting impact. By the end, I hope to provide you with tools, inspiration, and practical advice to help you and your family thrive. Rural areas like ours face unique health challenges. Did you know on average there are only 13.1 physicians per 10,000 people? That's almost the entire population of McDowell County. Even worse, that there are only 30 specialist physicians like cardiologists, pulmonologists per 100,000 people. And 19.5% of people who live in rural areas say their health is either fair or poor. We face even more risks in rural areas than our city-dwelling counterparts. The rate of increased death from cardiovascular disease is 21% higher. There is a 20% higher risk of death from diabetes, a 16% higher prevalence of diabetes in rural areas. The risk of injury-related death in rural areas is 22%, and an astounding 50% of all motor vehicle crashes happen in rural areas, despite less population. Our children also smoke more in rural areas, about 26.6%. 14.6% of people in rural areas have to rely on the Supplemental Nutrition Assistance Program, or SNAP benefits. 16% of people in rural areas are on Medicaid. 43% of people have Medicare without drug coverage benefits. And 30% are dually eligible Medicare beneficiary, which means that the individual is entitled to benefits from both Medicare and Medicaid. We have limited access to healthcare providers. Many of us travel long distances for care, and finding specialists can be difficult. We have higher rates of chronic conditions such as diabetes, heart disease, and COPD. All of these conditions need specialist physicians to help manage them. It makes it harder to prioritize health and attend regular appointments when there are transportation and financial challenges. On top of that, there's a shortage of mental health care providers in rural communities. Did you know that our children are twice as likely to commit suicide in rural areas? But despite these challenges, there's hope. Together, we can overcome many of these barriers with small, consistent steps that prioritize our health. A wise man once said that challenges are not immovable mountains, but are opportunities for growth. That which stands in the way becomes the way forward. Marcus Aurelius. Prevention is the foundation of good health. This means taking small steps to avoid chronic conditions or prevent them from worsening. The key strategies include regular checkups for screenings like blood pressure, cholesterol, and blood sugar. Staying on top of vaccinations, especially for flu and pneumonia. Building healthy habits like eating well, staying active, and avoiding harmful substances. When was the last time you had a checkup? Could catching something early make a difference for you or a loved one? We all have a general idea of what is healthy and what is not healthy. We are going to explore options for healthy eating on a budget, but first, we need to be on the same page with what is not healthy. We all know the Western diet, high in processed foods, red meat, and sugar. This leads to serious health risks. Research shows that increases like the likelihood of heart disease, diabetes, and even certain kinds of cancer. The Centers for Disease Control says that 41.9% of all American adults are obese. And there are 19.7% of American children who are obese. Medical News Today says that 28% of people who eat the Western diet have a higher risk of heart attack and stroke. 37% have a higher risk of heart failure because this diet is high in cholesterol, saturated fats, trans fats, excessive sodium, and an increase in moderate amounts of alcohol. Overall, there is a 22% increased risk of heart disease. Did you know that 90 to 95% of diabetics are type 2 diabetics? The risk of becoming a diabetic increases if you're overweight or obese. The research shows that there is a significant link between type 2 diabetes and diet. The Western diet has a low amount of whole grains, an excessive amount of refined rice intake, processed wheat, and processed meats. When you are overweight or obese, it also increases the risk of getting certain types of cancer. This includes breast cancer, colorectal cancer, gallbladder cancer, pancreatic cancer, and thyroid cancer, just to name a few. But healthier eating doesn't have to be expensive or difficult. Let's explore 3 types of healthy diets. First up, the Mediterranean diet. It's high in fruits, vegetables, whole grains, and healthy fats like olive oil. Research shows that it reduces the risk of heart disease, strokes, and certain cancers. The DASH diet, which is focused on lowering blood pressure with foods rich in potassium, magnesium, and calcium. Potassium isn't limited to the banana, you know. The humble potato is rich in potassium. Plant-based diets, which includes more fruits, vegetables, nuts, and grains, while minimizing animal products. In fact, the Mediterranean diet can be considered a plant-based diet. These diets lower the risk of obesity, diabetes, and other chronic conditions. Let's talk about affordable tips for healthy eating. Buying in-season produce for fresher and cheaper options. Use local resources like the Go Grocery Market in Welch. Meal prep to save time and money. Make use of the leftovers. Start a small garden, even in containers, to grow your own vegetables. I've included several recipes in the handout that can help you make amazing tasting, healthy food, all compliments of America's Test Kitchen. I love those guys. Exercise doesn't have to mean going to a gym. Activities like walking, gardening, or even house chores can keep you moving and healthy. The goal is 150 minutes of moderate activity each week. But start small. Even 10 minutes a day can make a big difference. So let's talk about some practical tips for staying active. Turn house chores into a workout by adding music and add extra energy. Take short walks during breaks or after meals. Invite family or friends to join. Group activities are more fun. In the handout, I've included a 30-day walking tracker, a physical reminder to be not sedentary and get up and move. Stress can take its toll on both our mental and physical health. It's important to find ways to manage it. As many of you may not know, I have had a stroke. I've had to relearn how to walk, talk, and even think. I found that meditation helps order the mind when it's nothing but chaos. Even spending 10 minutes in the morning before you start your day as long as you are persistent, will lead to dramatic changes later. But meditation may not be enough. Southern Highlands offers counseling and support if you need someone to talk to. Don't hesitate to reach out if you feel overwhelmed. Their crisis phone number is 1-800-615-0122. They're available 24 hours a day, 7 days a week. Or you can go to the Welch Clinic. Their phone number is 304-436-2106. There are simple things that we can do to help manage our stress besides meditation. Simple techniques like deep diaphragmatic breathing will help limit your stress as well. Step 1. Sit or lie down in a comfortable position on a flat surface. Step 2. Sit up straight and pull your shoulders back to relax them. Step 3. Put one hand on your chest and one hand on your stomach. Step 4. Breathe in through your nose for about 2 seconds. That was step 5. Purse your lips, press gently on your belly, and exhale. Repeat steps 4 through 5 several times. I guarantee it'll help. You know, an old chemistry professor of mine once said, "The solution to pollution is dilution." Many things in life are toxic to us. Even something as benign as water, in excess, can be toxic to us. Toxicity is all about one thing, and one thing alone: concentration. And that is what Dr. Bly was alluding to. It doesn't mean that you cannot be exposed to it. It does mean, however, limiting the amount you are exposed to. This is especially true of tobacco and alcohol. Smoking increases your risk for coronary heart disease, cancer, and pulmonary disease. People also benefit from quitting smoking even after they develop coronary heart disease or COPD. Did you know that smoking accounts for nearly 33% of all cardiovascular deaths in the United States? Did you know that quitting smoking reduces the decline in lung function? Also, for people with cough and sputum production associated with the early stages of COPD, these symptoms improve in the first 12 months after quitting. Smoking also increases the risk of infection, developing type 2 diabetes, osteoporosis, spontaneous abortion if you are pregnant, and even the development of cataracts along with other complications. If you smoke, consider quitting. It's one of the best things that you can do for your health. There are resources to help, including nicotine replacement therapy or counseling. West Virginia has its own smoking cessation service where the counselors are specifically trained to help tobacco users quit. The phone number is 1-800-QUIT-NOW. That's 1-800-QUIT-NOW. You can also text them at 304-583-4010. So if you drink alcohol, do so in moderation and be mindful of how it affects your health. Personally, I drink wine, but I do so in the ancient Greek way: 1 part wine to 3 parts water or juice, and limit its consumption to 1 to 2 glasses only on certain days of the week. The ancient Greeks would call anyone a barbarian for drinking wine without diluting it first. So don't be a barbarian. Many of us don't drink enough water. Staying hydrated is vital for overall health. Instead of sugary drinks, like pop, try water with a slice of lemon or a few berries for flavor. It's an easy way to cut out extra calories and improve how you feel every day. Now, if you're exercising, you need to drink 1 17-ounce of water for each hour during exercise. Ensure you listen to your body when it says it's thirsty. And oftentimes, when you think you're hungry, that sensation is really you're thirsty. Try to drink first. And if that doesn't satisfy it, then you can eat. So here are several variations to suit your fancy when you need a flavor boost. Summertime sips including cucumber water, grapefruit, blackberry, and sage water, pear and vanilla spritzer, mango and lime spritzer, and for wintertime flavors, you can try these stalwarts, bubbly sage cider, and winter citrus and pomegranate water. Now, once again, thanks to America's Test Kitchen, I love those guys, I have included recipes for these in the handout. Marcus Aurelius once wrote, "Meditate often on the interconnectedness and mutual interdependence of all things in the universe. For, in a sense, all things are mutually woven together and therefore have an affinity for each other. We are stronger when we work together as a community because we are all interconnected." Think about starting a walking group, volunteering in a community garden, or hosting healthy cooking classes. Small efforts like these can bring us closer and make healthier living easier for everyone. Here's a list of local resources to help you on your health journey. From clinics to mental health services to farmers markets, these organizations are here for you. If you're not sure where to start, reach out. I'm happy to connect you with these services. I have only provided a few here, but in the handout itself, I've provided a comprehensive list of services available in the county. To wrap up, I challenge you to set one small health goal this week. Whether it's drinking more water, taking a walk, or trying some new fruit, small steps can lead to big changes. Let's commit to a healthier future together. I leave you with a quote from one of my mentors. "The journey of 1,000 ri, or in this case miles, proceeds step by step." Miyamoto Musashi. This man turned to dust 500 years ago, but his wisdom endures. It reminds me to keep pressing forward, learning new things, and each step, no matter how small, matters because it's a step in the right and only direction, forward. Now, before you go, don't forget to download the handouts I prepared. They include easy, healthy recipes for your family, drink recipes, a 30-day walking tracker, and a directory of local resources. Once again, thank you for watching.